So if you have those intrusive thoughts, what you can do is you can picture a big stop sign in your head that'll cover everything, and that will help train your mind to stop those intrusive thoughts.
So, does this work quickly?
Well, what's your definition of quickly? It's going to be based on the individual. It can work quickly, but it's all in how your brain has to heal, and you have to kind of retrain your thoughts. So it's going to be, how much training you're willing to put in, and how fast you're going to heal.
Okay, my aunt is getting married in 2 months, so I really want to be able to go without having to go hide in the bathroom every 20 minutes.
Well, we can set that as a goal for our time together, is to get you to where you can go to see her wedding without having to feel like you got to hide in the bathroom every 20 minutes.
Okay.
So we can kind of set that and work towards that. That's a very achievable goal, I feel.
Okay. So yeah, I didn't know if this was something that would, helping me with the stop sign, and I didn't know if it was gonna be a lengthy process, or if I'm just so ready to feel normal again.
Right. Well, I can understand that. CBT, or cognitive behavioral therapy, is science-based. It's got a lot of evidence behind it. It is effective. So this is not something that we're just kind of making up as we go along. So it's effective and it'll work. And if it doesn't, then we'll try something else with that goal in mind of getting you to your aunt's wedding.
Okay.
Okay. I make that commitment to you, so that way you know that I'm here.
I really appreciate that.
Sure. What other issues are you dealing with as far as daily living?
It's mostly just, I just don't want to do anything. I don't want to leave the house. I have to sometimes, when I need food.
Right.
But even going to the grocery store is there's just people everywhere. There's so many noises. It's just very busy. It's really difficult to handle sometimes.
What kind of music do you listen to, if you don't mind me asking?
Well, I kind of listen to I listen to a lot of different kinds of music. I listen to some, classic rock, and I like folk music.
Okay. Is there any music you find that you listen to on a regular basis that you find relaxing?
Yeah, there's a lot of folk bands.
Okay.
They have the acoustic, and I listen to it mostly because it's calming.
Okay. One of the things you can try is when you have to go to the grocery store, and I don't do this when you're driving, of course, but when you get out of the car, iPod or phone or whatever it is you're using, maybe you can put earbuds in and go into the store listening to that kind of music, and then try to do your shopping that way until we can get you a little bit farther along.
I think actually that would help a lot, because it's just very overwhelming.
Right. One of the things also, one of the things I'd also like to talk to you about is do you have any pets?
Yeah, I have a dog.
Okay. Do you have room? This is just an idea, so I want you to just think about it, and if it's not going to work, or this is not something you're interested in, just let me know. Can you afford to feed another dog? Do you have enough room to?
I'm sorry, can we go back? You wanted me to say I didn't have a dog, right?
That's fine.
Are you? Because no,
we'll just roll with it.
I'm sorry.
That's okay. That's all right. We'll just roll.
I'm sorry.
That's okay. So what I'm getting at is that there's a service animal program that has shown that it has benefits for people that are dealing with the PTSD and stuff like that.
Sorry, my mom's calling me.
That's all right. Well, we're almost done anyway. So the service animal, it's for people with PTSD and for service members. It's like a guide dog. Only it's there as a companion, and it's reassuring, and it knows that it's been trained to help people get through panic attacks, and it's so you may have seen them. I don't know.
Yeah, I've definitely heard of that, and I have a couple of friends who got service dogs.
Okay, so think about that, and if that's something that you're interested in, pursuing, then we can gather some more information and make the right phone calls for that.
That sounds great.
Okay. Okay. So, do you have any other questions or any other concerns or anything you want to talk about?
No, I think we covered it.
Okay. Well, I guess then I will just see you next week.
Okay, great.
All right.
Thanks.
Thanks.